launching a task force to search for at-home COVID treatments in the form of a capsule or tablet.
Today, we're creating a new Antiviral Task Force to search for the most promising new medicines and support their development through clinical trials with the aim of making them safely and rapidly available as early as the autumn. This means, for example, that if you test positive, there might be a tablet you could take at home to stop the virus in its tracks. Or, if you're living with someone who has tested positive, there might be a pill you could take for a few days to stop you getting the disease yourself.
Wow, Dr. Nagat is joining us now with her take on the news. What do you think of that, then?
Actually, it's not anything that's unusual. Remember, we have loads of antivirals. So antivirals are a bit similar to antibiotics. What they do is that they break down the virus in order to make sure that we don't become really poorly or sickly from it. So we've got acyclovir that we use for shingles, which is a virus in itself, the herpes zoster virus. We've also had Tamiflu. Do you guys remember Tamiflu? We used to have that for bird flu or swine flu back in the day. And also we now use Tamiflu for influenza A and influenza B. And it works brilliantly for some people. If we get it in early enough, antivirals can actually make you feel less sick. At the moment, the advice is that if you are poorly with COVID-19, please self-isolate, take paracetamol and ibuprofen and hydrate yourself well. Water is something that we really do need a lot of when we're poorly, because we sweat a lot and also our immune system uses water to fight infection. So this is great news, and this means that if we can get this in our armoury of stuff that we're doing already, so we have the vaccines, which are doing amazingly well. We've got still restrictive measures in place. We're hand washing, we're face covering, we're physical distancing. Then hopefully we shouldn't have to have a fourth lockdown.
Well, it sounds
well, I would hope not. After what's the point of a vaccination if you have to have another lockdown if you're treating all the vulnerable people? But the thing is also that 32 people were hospitalised with COVID after having the vaccination. So it is working.
It is definitely working. So I've been vaccinating in our community hubs. I'm a vaccinator. We've been doing the Oxford AstraZeneca vaccine. And honestly, Phil, Rochelle, it's amazing because people are coming. We were really worried because Ramadan started on the 13th of April that actually people wouldn't turn up for their vaccine when they're invited, but they're still coming. They're coming for their second doses. And yesterday, Nikki, who's our primary lead, said that 3 times more ethnic minorities are turning up for their vaccination. So even the hesitancy groups that we had, they're still turning up. And the fact that we are having less deaths from COVID-19, the data is so positive. So 1 dose of Pfizer vaccine, 97% less chance of becoming severely sick. Remember, we need the vaccine in the younger population because if they get COVID-19, yes, they won't be hospitalised by it, but long COVID is causing a lot of harm, and I'm seeing that in my surgery.
Right. Taking vitamins cuts risk of COVID infection by 13%. OK, researchers from King's College London who have been using an app to track people in Britain with symptoms of coronavirus found that simple supplements appear to play a role in cutting your risk of catching COVID.
So we've known about vitamins and how much great they can do. There's always this umming and ahhing, do I need vitamins or not? But the Zoe app, which is by Professor Tim Spector from King's College Hospital, they've been tracking all the symptoms and seeing what works. So if you remember back in 2020, we were always arguing, does vitamin D have a role? And there is some evidence to suggest that it can boost your immune system. But from the app and the research that's coming out from Guy's and Thomas's, actually only 9% will give you improved chances with your immune system. Omega-3 actually is another thing that's having a lot of benefit as well. And this might actually put a lot of people off, but the old ginger, you know, they say take a bit of ginger tea, that's going to help you. Actually, there's no evidence so far.
Oh, no. I was just going to say, I've been doing it every morning. I actually have had one this morning.
So sorry to burst that bubble. But the other interesting fact that they found from the studies is that for women, there seems to be more beneficial impact taking multivitamins as opposed to men. And that could be because of the biological changes within men and women. And I think this is really key because there's a lot of information and data coming out that estrogen is actually protective, so it boosts your immune system. So this is really important. So we need to think about women who are menopausal and postmenopausal and have a lack of estrogen. Should we be thinking more of estrogen as a different hormone in order to boost our immune system for longer, better health? So this is really powerful stuff that's going to come out, and it's the one to watch out for, really. Because estrogen's always naturally had this horrible feedback around it, and there's been this conspiracies about breast cancer and clots, and it's always been negative press around it. But I think we need to start thinking of oestrogen as a protective hormone for our immune system.
Amazing. It's lovely to have you here. It's lovely to be positive.
I'm trying to be positive.
And
We have to be.
That was positive news.
We have to be. I think.
Well, I
there's
listen
so
to
much
all
going
our
on.
doctors so much that they say, well, in the early stages, you should take this, you should take this, but I haven't stopped. So if I get up now and run, I rattle.
Rattle.
Yeah, thank you.
That's what that noise was.
Still to come, Clodagh McKenna's in the kitchen with a